is Emily Sandoval, and I did my presentation on bipolar disorders. By definition, bipolar disorders are a type of mental issue that causes mood swings from being emotional highs to extreme lows. And there's three different versions, as you can see here. Bipolar 1 is a person must have consistent mania episodes, which are more critical, more erratic, and can be violent, which is then followed by normally a hypomania episode, which is a lesser version of a mania episode, or it can be followed up by a very, very suicidal, depressive episode. But of course, with medication, it can't be treated. There is bipolar 2, which I personally am diagnosed with. So having both a major depressive episode and a hypomania episode. A hypomania episode is not as severe as a mania episode, which we normally see in the bipolar 1 version, but patients with bipolar 2 are more quote-unquote hyper. They are more they tend to have more ambition, so to speak. That is a little bit more uncontrollable than normal. And then there's also cyclothymic disorder, which is not as common to hear when discussed with bipolar disorder. It's actually the lower level of bipolar. These people tend to actually need to have 2 years of consistent monitoring, with a healthcare professional, because they can have common likeness with patients with bipolar disorder, which can include hypomania episodes and periods of depression. Some causes to bipolar disorder, however, there's multiple reasons that scientists try to link as to why people have this disorder. There isn't one solid reason or a definitive reason as to why people are diagnosed. Some causes are related to there being maybe a genetic or biological difference, such as changes to a person's brain growing up from being a young small infant into a young adult, or the fact that in most cases, people who are diagnosed with bipolar disorder usually have someone in their family who also may be diagnosed with it or have been undiagnosed. However, regardless whether you know someone with bipolar disorder in your family or you're the first person to even be diagnosed in your family with bipolar disorder, if left untreated, it can severely damage relationships. It can cause poor work ethic performance, especially with depressive and hypomania episodes. They can cause a decline in the work environment, especially with colleagues who don't understand the medical background, because in most work environments, medical history, of course, is very private. It's not relatively shared, so it can be difficult to interfere. And also untreated, it can cause people with mania or even hypomania to go down and spiral down with drug use, and in their depressive episodes, if not treated, can lead to suicide. the importance to public health with bipolar disorder, it actually locally affects 2.8% of the population. Worldwide, it's more well known, and it affects roughly 48 million people a year. Considering, however, it is the sixth leading cause of disability according to the WHO, the World Organization, and greater awareness will allow patients to seek help, and they're able to monitor who is being diagnosed, what demographics, and whether or not this is a severe issue. And in most cases, we haven't seen a giant trend. The giant trend that we do see with patients being diagnosed with bipolar disorder is within those who are in the age range of 18 and 29 years old. And the most important reason for public health awareness would be for the less stigma, because currently bipolar disorders do have a stigma as to being a little bit psychotic. There isn't enough information as to why they can't control. So in most cases, it establishes that they are unworthy and not able to be given a chance to show that they can prosper. There are different ways to manage and educate people with bipolar disorder. Medications and versions of psychotherapy can be treated and actually is very effective with treating bipolar disorder. With such medications being antidepressants, antipsychotics, and antipsychotics are mostly dealt with mood swings, which are very common with bipolar disorder. And it actually works to help prevent anxiety as well, as most antidepressants can also help hinder that. Some of the things that patients with bipolar disorder can do is exercise regularly, having a mindset of having structured activities really helps focus the brain, and chart prepping their moods, being them in order, organizing their thoughts, are some ways that many bipolar patients can do to help manage. And overall, educating the general public that bipolar disorder is not a label. It's a part of who a person is. It's not people that are crazy or unsafe to be around. And having more people educated about bipolar will hopefully create this sense of a safe environment for all those involved, all things considered. If you have a type of bipolar disorder, or you know of somebody who's recently been diagnosed, I would personally tell you to reach out to them, to be there for him or her. No person likes not being in control of their life, and having a disorder that prevents them from controlling their emotions is very frustrating. Personally, coming from someone who experiences and deals with it on a daily basis, having support does make the difference. Learning, even trying to associate it in different levels with your loved ones does make a difference. And overall, having help from your doctor, reporting any difference in your symptoms helps to make sure that your medication is keeping you on track. And it helps to know that you're not alone and that being bipolar doesn't make that isn't your personality. It's not a personality. At the end of the day, bipolar patients are just like everybody else, just trying to have a healthy life.